it's pretty mind bending to think about with how far along they're. I mean, I mean, these Trump people, especially, are going. But let's go. Let's see. Where is this thing? All right.
Yeah, I was fighting with my mom
So
earlier.
the CDC recommends
Oh.
that if your
No, Mike doesn't
positivity
deserve
rate
that.
is above 5%, that means you shouldn't be reopening your state's economy. Anything above 5% means that's too high. Once you get below 5% in terms of positivity rate, you can start to reopen the economy gradually if you want to do it safely. However, the positivity rate in South Dakota is 58%. 58%, nearly 60%, meaning the majority of people who take a COVID-19 test positive. And this is a small state. So it is very, very serious in this state. But their state's Republican governor has deliberately not taken any action, is pretending as if COVID-19 isn't a thing because she's a Republican and she thinks that this makes her a better politician because she is giving people in her state liberty, and because she's not doing anything, the people in her state are happy.
Yeah,
This is according to her. It's just
like we've been saying all along, the good politician, the good businessman thing to do was do what we said
Right.
in the springtime, nip it in the butt. If we had just done that, everybody had stayed home and worn a mask for like 2 months, we would be free and clear,
Yeah, no, if I keep thinking about a scenario that if Trump would have just jumped on it and like used it to brand his election and just even if he sent out 5 million MAGA masks to everybody, right?
He would be winning right now.
Yeah,
I mean, he would have won, I'm saying.
Yeah, I'm sure he probably would have won. Can you imagine? Like, I think people would have, like, people with enough common sense to know how serious this shit would have worn the fucking masks if that's all they had.
Yeah.
And then and everybody that's Team Trump would have jumped immediately on board and worn them all over the place just to wear them.
They did the right policies in the beginning too, like with the CARES Act, like aside from all the, the socializing the stock market, like that was terrible, right? They shouldn't have done that. But like the actual stuff they did with the expanded unemployment and the $1,200 stimulus and the paycheck protection plan, like they had the right policies. They had it right there. But like everything, they fucking underfunded it. And they underfunded it for optics. Like they were scared that it was going to look too expensive. And then they were the whole like red state, blue state thing. They wanted to make that a talking point and ramp up the culture war shit. And like, because he was trying to win the election, right? So like the whole messaging made it adversarial from the beginning instead of doing a unified thing and just doing it like the competent businessman he pretended to be. Yeah. And they also didn't fund any of the state and local governments, right, who desperately needed it, because that's a huge part of the economy that's going to bite us in the ass. Without having the municipal workers, without having people working for the government, when you cut thousands and thousands of jobs from local government, that's a huge chunk of the economy that people don't have money to afford, who are on unemployment and are otherwise like not able to participate in the economy. Having those people working for the city is a nice baseline. Those good, well-paying union jobs, people who work for municipal governments. Without that, because that's what cities are cutting. Like in my city, that's what they're cutting. They have to cut thousands of jobs. In New York, they're trying to cut thousands of jobs from the local government. That's going to hurt. Like if they had done that, along with the paycheck protection plan, where you pay your worker, you keep paying your workers, and the government reimburses you, we would be done, and the economy would be thriving right now. Right. And fucking Trump would be on his way to his second term, right?
Yeah, but let's see from the chat. Interesting, shutting down schools and now businesses. I wonder how people will deal with having to go to work in NYC. And it seems like Trump didn't want to win. A second stimulus would have even helped his chances. Well, I mean, at the end, he was pushing to get the stimulus, and I think, look, with all this shit, I don't think it was all about grift that he's doing in court. I think he really did want to hang on to power. He would have preferred to win than not win. but
Mm-hmm.
he just didn't. He rather try to look alpha and
Well, I
say
think
you
they
don't need
convinced
masks and
him.
all this shit. I mean,
Yeah,
do
that
you
was
think
fucking
somebody?
dumb.
I mean,
That was so
somebody
dumb.
convinced him not to go ahead and send out the mask on the in January. I mean, I
No,
don't know.
I think that was him because nobody would tell
Yeah,
him that.
right.
Nobody would tell him that looks alpha because it doesn't. It looks
Yeah,
dumb and it really fucked up their chances.
right.
And like they still almost won because people are suffering so much and the Democrats suck so bad. But like he had just done that, handled that shit in the beginning.
Yeah.
He would be, like I said, he would be on his way and he'd be gloating so hard and
Oh
like,
yeah, he would have been. I defeated the virus, folks. And but this
yeah.
time it would actually would have. He actually would have been right.
Well, he like doubled down on like coming
Say
up with a vaccine, right? Like that's
right.
what he thought he would be able to do because like
Yeah,
he
and then what happens? The
didn't.
vaccine comes out. All this vaccine news comes right after he loses, and
It
then
was never going to come out in time, though. He knew that,
no, no, of
you
course
know.
not. This shit takes time. You know the thing. I mean, the fact that we have so much news coming out of it, less than a year out is encouraging because I mean, from the all accounts from the very beginning, they said the shit was gonna take a year and a half. So,
Yeah.
all right, let's go back to Mike on here.
It's honestly puzzling that this is happening. Like, you'd think that a global pandemic would not be a partisan issue, but in 2020 America, of course it's a partisan issue, and it's one of the most divisive issues of our time, right? So, there was a thread on Twitter by a nurse who is in South Dakota who's working on the front lines with COVID-19 cases and patients, and what she said here, it honestly was shocking. So she tweeted this out. I have a night off from the hospital. As I'm on my couch with my dog, I can't help but think of the COVID patients the last few days. The ones that stick out are those who still don't believe the virus is real. The ones who scream at you for a magic medicine and that Joe Biden is going to ruin the USA,
Oh,
all while
dude.
gasping for breath on 100% Vapotherm. They tell you there must be another reason they are sick. They call you names and ask why you have to wear all that stuff because they don't have COVID because it's not real. Yes, this really happens. And I can't stop thinking about it. These people really think this isn't going to happen to them, and then they stop yelling at you when they get intubated. It's like a fucking horror movie that never ends. There's no credits that roll. You just go back and do it all over again, which is what I will do for the next 3 nights. But tonight, it's me and Cliff and Oreo ice cream. And how ironic, I have on my home hoodie. The South Dakota I love seems far away right now. Now, when I read this shocked me, and what she said stood with me. Like it was on my mind for days after I read it, because this is just
Dude.
shocking. Like, you would think that the denial ends once you're personally affected with something like COVID-19, but they still deny it even when they get it, and they literally are dying from it. I mean, what do you even say? There's no words that capture how sad this is. And this is sad. Like, these are human beings that probably, didn't believe this was a thing. They didn't take any precautions. They ended up getting it, and they still, denied it as they're in the hospital dying from it. I mean, I don't even know what to say about that. Like, this is horrifying. Now, this thread went viral, and she went on to CNN, and she explained a little bit more about her experience, and this is unreal to me. Like, I wouldn't expect this to be a thing that happens, even with how delusional Trump supporters are and how cult-like they are. Like, again, you think that there is a point where, you stop believing in all of these weird things when you can see it, when it affects you on a personal, concrete level. But according to her, that's not the case with all of them.
Nurse Doering, thank you so much for being here. When I read some of your tweets, my jaw dropped. You said that even now, that the hospital is being overrun with COVID patients. They come in, they're horribly ill, they're gasping for breath, and yet they don't believe they have COVID?
Yeah, I think the hardest thing to watch is that people are still looking for something else and they want a magic answer. and they don't want to believe that COVID is real. And the reason I tweeted what I did is it wasn't one particular patient. It's just a culmination of so many people.
Wow.
And their last dying words are, this can't be happening. It's not real. And when they should be spending time
Wow.
FaceTiming their
I don't mean to
families,
laugh. It's horrible.
they're filled
but
with anger
Jesus.
and hatred. And it just made me really sad the other night. And I just can't believe that those are going to be their last thoughts and words.
Anger and hatred towards you?
I think it's just a belief that it's not real, and nursing happens to be on the receiving end of that. And that's okay. We can take that. That's what you're there for. It's just in the bigger picture when you try to reason with people of, can I call your family, your kids, your wife, your friend, your brother?
Yeah, you're dying.
And
You're not going to make
no,
it.
because I'm going to be fine. And you're watching
Jesus
their
Christ.
oxygen levels, maxed out on what we call vapotherm at 100%, and their oxygen level might be 75.
Oh.
It's not really that compatible with life, and we know where that's going to head. And it just makes you sad and mad and frustrated. And then you know that you're just going to come back and do it all over again. And that's kind of where that stemmed from.
How could it not make your own head explode? They're gasping for breath. Their oxygen levels are dropping. What do they think is wrong with them?
I think people look for anything. People want it to be influenza. They want it to be pneumonia. They want it to be, we've even had people say, well, I think maybe it might be lung cancer. Something so far-fetched. And the reality is, since day one, when COVID started in this area in March, you've kind of been able to say, if it walks like a duck and talks like a duck, it's a duck. Like, I hate to tell you that you have COVID, but that's what you have. Even after positive results come back, some people just don't believe it. Now, that's not everybody. We have a lot of patients who are very, very grateful for their care and very thankful for what you do. But unfortunately, that's not what I'm remembering right now. And as my nursing career, that's not what I want to be remembering for. I want to remember the saves and the happy situations. And what I was remembering chilling on the couch the other night with my dog was not that.
Of course not. Of course not. And it's just so mind-blowing to think that they would rather have lung cancer. They'd rather a diagnosis of lung cancer than of coronavirus. And so, you've said that it was, if I quote you from morning television, it was an effing horror movie that you live every day. And so what toll is this taking on you?
Yeah, hindsight, I didn't realize that this was going to go viral. I probably could have left the F-bomb out of there, but the reality is that's how you feel. And so it is like, it's just a movie where the credits never roll. You just do it all over again. And it's hard and sad because every hospital, every nurse, every doctor in this state is seeing the same things.
Now, the part of that really,
We'll come back. We'll leave it there. But what do you make about that kind of shit, bro? I'm just getting like this mental picture of whoever is there in a hospital, and they're dying. Their life is slipping away. Their oxygen is right there at 75, like she said. So it's supposed to be at least above 90. Even if it drops close to 90, it's bad. So obviously this is like they're pretty much their last moments, and they're still out there saying this isn't real, and they're trying to call their families and say, do you want to just talk to your family before you die, basically? And they're all saying, no, I'm gonna be fine. This isn't real. This isn't COVID. I don't care about it.
I don't know what to make of that. I don't know. Like, I haven't met anybody who doesn't believe in COVID. Like, I know people who think it's, I think a lot of, like, most people on the right seem to think that it was, trumped up to hurt to hurt Trump's reelection.
Yeah.
Trumped up to hurt Trump. Like, they thought that it was, the media was fear mongering about it because they wanted to make Trump look bad. And like, none of the problems were as serious as they thought. And I think that's, I think a lot of people internalized that and then, didn't want to wear masks. And,
right.
Like you said, it was a culture war thing they turned it into. And, it was a bizarre culture war topic, but it's spread around the world too. I don't know if you noticed that, but like, they have like anti-mask protesters now in Europe, and that's part of why they had their spike, right?
Right.
Was that, but like, I never met anybody who's like denied it actually existed. So like, I don't know, you're sitting in a hospital bed. I don't know at that point why it matters if it's COVID or
Or
something else
yeah, or
that's got
lung
you all fucked
cancer or
up. Like,
flu or something, and
yeah.
they don't believe they're gonna die from it. Like
And they
they're in
just
that.
blame China.
Yeah, you imagine going out like going out like that. Just the last thing you do is blame. Blame China as they put the blanket over your face and shit. I'm like, oh,
It's
jeez.
like, who, yeah, the China stuff is just like, I don't get it, because it's like, what do you want from China? Like,
Hmm.
what are you trying to change? Like, what about it would be make your suffering
Right.
any more or less
I mean, at
real
that
to
point,
be
does
able
it?
to
None of
blame China?
you're dying. At what point does any of that shit matter? Like, do they not get that they're dying? I don't. But let's go to the chat again. Let's see. It's dark. I'm interested in reading a deep dive analysis into what
Yeah,
the
me too.
psychology is behind these people will not change their minds even on death's door. The whole shoot somebody on Fifth Avenue logic. Millions think like this. Yeah,
I think
it
it's
is
tend to be less
astonishing.
educated people too.
Yeah.
Not all of them, but like, we know like Trump's share of the voters with, New York Times just did a big deep dive into it, but like, you know, non-college educated voters
Well.
tend to go to Trump,
Mm-hmm.
especially, these are like in rural parts of the country. It's a lot of like, the white working class, the I was trying to think of a joke about the racist dog whistle,
Uh huh.
um, but that's who's going for Trump. So these are people who are already kind of like, not that they're just they're they're susceptible to that anti-science thinking,
Mm-hmm.
like how to um, they don't necessarily trust the expertise of doctors or anybody
Right.
like that, public health experts.
So let's see. My sister Francesca has COVID. How do people not live? Are they just weak? That's the thing with COVID. It varies. It hits people so differently, just person to person, and even depending outside of what you actually have. So if you have lung issues going in and you get COVID, it really makes it difficult on you. But even
Yeah.
without that, even absent those kinds of conditions, for some reason it just hits people in a
Well,
different way.
I mean, some of the research makes it look like the initial load of it that you got
Right.
affects the virus's ability to colonize your body. So like,
Mm-hmm.
if you got it because you had a little bit on your hand and then like that got in your mouth and then you eventually came down with it, that would be easier to get rid of than if you were in a room with like, five dudes who had it and they were all coughing all over you.
Yeah.
So like the viral load, because that's not something that's weird, right? We don't have a lot of diseases like that. We don't have a lot of
Where
illnesses.
it depends on how much of it you
Hmm.
get. It can affect you, and but the other part of that too is you get weird side effects, like you get blood clots out of nowhere,
Hmm.
and then you have other shit that affects you. But the like the thing that stands out to me though, and people miss this, is a lot of the times it's not that it doesn't hit you. It's that your body, because you're in better shape or whatever else, you have a better immune system. Your body just can take that beating a little better than somebody else's body. And like I had like I told you, like my like I told you before, Matt. I remember my realtor had gotten it. Like, he was more of a young dude. They put him on oxygen. They had him on a ventilator for a little bit, but he was able to bounce back from it. Whereas, you get somebody older, maybe that's not as young, maybe has some kind of condition, and has to go through that same thing, and they're not gonna come back from that.
Yeah.
So
Yeah. No. Sounds right. Um.
yeah,
Yeah.
here we go. See this one. Um, if it was their fault, so they're going to get away with infecting the whole world. Hey, we infected the let them get away with it when it's okay.
Mm.
They don't deserve to be punished for killing a lot of people. I mean, do you think I mean, it's hard to say at that point because the people don't really. I don't know if there's like culpability on people for not doing their part for.
Yeah, but see, that's what you always say, though, right?
Yeah.
Like, you want to blame China, that's fine, right? But it still doesn't alleviate your need to take care of your own country, right? Like China dealt with it, right? Like I don't know if you saw that thing I sent you earlier, but it was like about what they do when they find the cases, right?
Right. There's a whole protocol in place that
They
locks down
found
their
two
shit.
cases, right? Exactly. This
Yeah.
was nuts. So they found two new cases, and they did, I think it was at 4 million or 10.9 million tests at 4,090 testing site, and they found 10 other people who were infected. They traced it back to where the initial infection had come from,
Right.
and locked everybody down, and then they were done, right? That's it. Like, there are ways to deal with this. Like, competent countries dealt with this in ways like that, right? You find out who's sick, and then you contact trace. You find everybody they came into contact with. You find the initial vector. You test all the people in the chain, and then you isolate the people who have it, right? Like, this is not like we've known how to deal with pandemics for 100 years now, right? It's just all those factors we were talking about, the partisan nature of our country, and the way it's very difficult to get any kind of policies implemented. The way it's like hard to get any kind of like national laws in place, all of this stuff, and then nobody wanted to pay for it, I think is the main thing, right? Like the federal government was trying to get all the states to pay for their own test and trace programs, and they couldn't do it, right? Because it's really expensive, and they were losing a huge chunk of income from not having the taxes from the economy's like economic activity. So these broke ass states with suffering with no federal aid were supposed to implement their own contact tracing program. And like very few places seem to have done it. Like you guys were doing it down there, but I don't know how effective it was. Like we were supposed to be doing it here, but I don't think there's any money for it. I don't think they kept doing it. So all these states have these kind of half-ass plans, and there's no coordination, and the other thing is like we have different rules in different parts of the country. There's different rules in different states, and you're supposed to quarantine when you travel to another state, but there's no enforcement for that, and there's no uniformity. So like it's just spreading, like continues to spread. And then like we were saying, you have this entire like half the country basically who basically doesn't believe in it or thinks it's something minor. It's just like the flu.
Yeah.
And they're not taking any precautions, just sharing it and making each other sicker,
Yeah, so I mean the whole thing, and then like the other part that people bring up is like if it's artificial, if it's manufactured or some other kind of shit.
It doesn't matter.
I mean, it doesn't matter. Yeah. It really doesn't matter at that point because it's less on where the origins came or where the virus origins lie, and it's more on what you're gonna do about it now that it's here. So you can't start a problem, and then the next thing is nobody does anything about the problem.
Exactly.
Yeah.
I think we will like eventually be able to probably study the genetics of the virus
and
itself.
Then that'll be more clear.
But where it came from.
But just to be clear, right now anybody assuming anything about the origin of the virus doesn't know shit. They're just trying to jump to a conclusion.
Yeah, so, I think it's equally likely that it came from some Western group that was messing around.
I mean, what was that shit that the origin of AIDS for a while that was like the propagated origin was that some dude fucked a monkey. I mean, I don't know how true that is. I never looked into the research of that.
It does. They try to like.
I mean, but I mean, what I ended up reading, what I did end up reading was that they would eat monkey meat, and there was some simian contaminant. Bush meat. Yeah, and then they try to blame it on Haitian immigrants that came through from San Francisco. So all this stuff takes forever to kind of figure out usually. So you can't assume anything about
they're all going to try to blame somebody else.
Yeah, exactly.
And the other thing is, Trump always brags about the lockdown or how he wouldn't let he banned China or whatever. And he didn't actually though. Like he banned Chinese people, right? Like he wouldn't let people fly to America from China. But if you were from a different country, you could still fly from China, right? It was just people who had a Chinese passport weren't allowed in. Right. And as we now know, most of the cases are early cases in New York came from Europe. They were
Exactly.
Italian and French cases.
Italian and French cases came through from Europe, and that's why New York was hit. Everybody flew right into LaGuardia and
And then there was no testing or anything at the
JFK. They
airport.
all flew in through those airports, and then everything spread like wildfire. So yeah,
And then we've done nothing. We
Fuckload
still don't
of
have
good
any
that
kind
shit
of
good.
national strategy.
yeah.
Like, we still don't have any uniformity. We still don't have, like, testing people at the airport. We don't have any of that shit. It's like we're still not really trying to